Hi, my name is Rachel Cooper. I'm a licensed independent clinical social worker and the manager of client services. I'm joined by Julia Lilly, also a licensed independent clinical social worker and program supervisor, and Chris Pederuti, a case manager in the client services team. Today we will be conducting 3 roundtable discussions to help you think about how you can approach different issues that you might face in your everyday work here at Harbor Health Services. The first roundtable will focus on talking to a patient with depression and anxiety. Depression and anxiety are very prevalent conditions amongst our patients. In fact, in 2012, depression and anxiety were the 2nd and 5th most commonly diagnosed conditions for our patients. We hope that through this discussion you can improve your comfort level and enhance your current skills in working with this population. The learning points we hope you will take away from this discussion include how to open a conversation with a patient who you think might be anxious or depressed, the role the nurse has in addressing mental health as it can affect physical health, the tools and processes for assessing depression and anxiety, and the resources available to patients suffering from these conditions.
A nurse recently came to me with a question. She walked into an exam room and the patient was sitting there prior to seeing the provider, and the nurse knew that the patient was coming in for a stomach ache, for a headache, and for feeling excessively tired. But the nurse also suspected that the patient might be suffering from anxiety and depression. What do you think is the best way to approach this issue with the patient?
Given the nurse's role as the clinical care manager within the patient-centered medical home, it's really important that you feel comfortable approaching these types of topics with the patients. You might say something like, "I noticed that you feel anxious or down today," and ask them how they're doing. Ask them an open-ended question. Maybe you could also ask them, is this something that they've noticed only recently, or has this been something that's happened in the past as well?
The patient later went on to disclose that her father passed away recently, and that she had been receiving counseling and medication for this issue. She said that she also had been having difficulties at work because of the anxiety and the depression, and that it had led to some financial difficulties.
I would definitely thank the patient for sharing this information and keep a really sensitive and comforting and professional manner. I might say something about how depression and anxiety can also affect a patient's physical health as well. And that it's really important that the information is shared with the provider, so when the provider conducts their assessment, they'll really know the full story to be able to identify the best course of treatment.
It will also be really important to explain to the patient that they will be asked some questions about their depression and anxiety. You'll want to help them understand how this information will help the provider assess what services, what support and treatment can be offered to the patient. We have tools for this. They're called the PHQ-2 and the PHQ-9, although this isn't necessarily important to share with the patient.
You could go on to explain to the patient what resources are available at the health center. For example, they might bring in a behavioral health consultant. This consultant would conduct a short assessment and brief treatment with the patient, perhaps for 1 to 3 sessions. In addition, they might be referred for longer-term therapy with a specialty behavioral health clinician as well. So there's a few different options.
I think that the patient could also be referred to meet with somebody from our team, to meet with the case manager to discuss some of the financial issues and what sort of resources are available for those.
So some key learning points we hope that you'll be able to take away from this roundtable discussion are to make sure to thank the patient and make them feel comfortable, to also let them know about the resources that are available to this patient, and also make sure that the provider knows the discussion that you had with the patient as well. The second roundtable will focus on de-escalating techniques when working with an angry patient. We hope that through this discussion you will hone your skills in de-escalation and increase your comfort level in handling these challenging situations. The learning points we hope you'll gain from this roundtable include ways to use your own behavior and physical appearance to de-escalate a situation, techniques to use when talking with an angry patient, and addressing issues of personal safety.
Here's a situation that I'd like to discuss. A patient has been waiting for their appointment for 30 minutes, The MA brings them into the exam room, and when the nurse enters, the patient is very angry and confrontational with the nurse. What do you think the nurse can do to de-escalate the situation and help the patient proceed with their medical appointment?
One of the first things to be aware of in this situation is your own physical response to the patient. It's important to stay calm and self-assured. Keep your facial muscles relaxed and look confident. Try to keep eye contact with the patient. Sometimes your own anxiety can escalate the situation, so try to use a low, calm voice.
You'll definitely want to try to avoid being defensive as well, even if the comments are directed at you. So be respectful with the patient. Treating the patient with respect will hopefully help the patient to treat you with respect and dignity as well. A few other tips would be to keep your distance and to allow the patient to avert their gaze. You don't want to hold their gaze the whole time because it might exacerbate the situation. In addition, try to avoid smiling because that might be interpreted as mockery.
I think it's also important to look for natural openings when speaking and not to cut the patient off. And when they're asking you questions, to answer the informational questions, but try not to give in to the escalating questions.
It's also important to give the patient options. Let them know that you'd really like them to stay to continue with the appointment today, but also let them know that they can reschedule if they need to.
Remember your own personal safety as well and the safety of others. You'll know within a few minutes whether or not your de-escalation techniques are working. If they're not working or if you feel physically threatened in any way, just end the discussion, leave the room, and access help.
And remember when you're with the patient in an exam room to keep yourself in between the patient and the door so that if you do need to leave, you can exit quickly and safely.
Finally, remember to complete an incident report if you feel like the situation warrants it. This incident report would be submitted to the on-site safety officer.
I hope that this roundtable discussion has helped to demonstrate some key skills in managing an angry patient and ways to de-escalate a difficult situation. Some key points that we hope that you can take away from this roundtable discussion include making sure to stay calm and keeping track of your own physical response, as this can affect the situation as well. Making sure that you pay attention to your own personal safety and really keep this as a priority, and definitely ask for help if you need it. This roundtable discussion will be about speaking on the phone with a patient who is a substance user, has recently been discharged from the hospital, and has had multiple recent hospital admissions for substance use. The learning points we hope you'll be able to take away from this discussion include how to sensitively address issues of substance use, the use of motivational interviewing techniques, and the resources available to patients with substance use problems.
Here's a situation I'd like to discuss. A patient has recently been discharged from the hospital, and the nurse is calling the patient to follow up on the hospital admission and to schedule a follow-up appointment. The patient has a history of substance and alcohol use, and the patient is also at risk for diabetes and hypertension. What do you think the nurse should say in this situation?
In this situation, I think it's important to consider the priorities for the clinical care manager. The clinical care manager has a role to reduce hospital admissions by helping the patient achieve greater stability in life. In addition, the nurse is often the person who is able to build a strong connection and relationship with the patient to maintain and strengthen that relationship with the provider and the health center.
The nurse also has a role here in making sure that this patient who's at risk for diabetes and hypertension attends their preventative care appointments, undergoes frequent blood sugar and blood pressure monitoring, and also conducts health education with the patient, including discussing issues around diet and lifestyle choices.
As far as addressing the patient's substance abuse, you can do this directly with them in a sensitive and professional manner. The patient's history of substance and alcohol use, and inquire about whether this is a current problem. This is
An opportunity to use some motivational interviewing techniques. The stages of change in the motivational interviewing framework are pre-contemplation. This is avoidance, that is, not seeing a problem behavior or not considering a change. Contemplation, acknowledging that there is a problem but struggling with ambivalence, weighing the pros and cons and the benefits and barriers to change. Preparation, which is taking the steps and getting ready to make some change. Action, that's actually making the change and living with the new behaviors, which is an all-consuming activity. And finally, maintenance, that's maintaining the behavioral change that is now integrated into the person's life.
The nurse can try to determine what stage the patient is in. Does the patient recognize that they have a problem? Are they motivated to make a change? Just by opening this discussion, the nurse might be able to move the patient from one stage to the next.
It is important for the nurse to talk about the priorities in terms of the patient's health and ask the patient what he feels he can work on. Is it substance abuse, weight, monitoring visits? What will the patient agree to?
Yes, it's important not to push the patient into anything he isn't ready for. Although we might think detox or rehab is what the patient needs, he might only be ready to cut back a little or agree to attend monthly monitoring appointments.
The nurse can work to facilitate ongoing engagement with the patient by building a good relationship and also helping the patient address barriers like transportation issues or lapses in health insurance.
It is also useful to consider who else to include in the patient's care team, like behavioral health, client services, the care coordinator, or other professionals at the health center.
The key learning points we hope that you'll be able to take away from this roundtable discussion include the stages of change within the motivational interviewing framework, and that relapse is possible, and that people can move back from one stage to another. Also, it's really important to meet the person where they're at. Helping them to prioritize the needs is important, but allowing them to make choices that they feel comfortable with is really a priority so that that person can be the healthiest that they can be. I hope that these roundtable discussions have been helpful when thinking about the skills and resources needed to manage the challenging situations we face every day at Harbor Health Services. Please remember that you can always contact our team, Client Services, for support and advice.
Welcome to the Harbor Health team, and we look forward to working with you in the future.
And thank you for participating in this program.